So to achieve agency, you actually need to be able to, as the definition states, initiate, execute, and in this case, inhibit your own actions. The exact challenge that apraxic individuals with complex motor systems have. So we really have to think about what's at risk when we aren't considering the motor system's role in actions and all the different ways that motor can be impacted. Consider the example from the Power of Showing Up book. A child might have trouble with a task, and adults in their lives maybe attribute the child to being lazy or stubborn or manipulative or just bad. And the adults are constantly reprimanding this child and calling the child lazy or disobedient. And I gotta hand it to them. Adults are probably have the best intentions. They may intend to drive home a good outcome from this child, but they're actually doing more damage than good. Not only to the relationship with the child, but also to the child's own perception of themselves. The child could internalize the adult's perception and develop a negative view of themselves. Furthermore, research actually shows that frequent experience of shame during childhood correlates with higher rates of anxiety and depression throughout the lifespan. The way others view us, especially adults and parents in our lives, can affect our own feelings of self-worth. Without the correct supports, successful responses and actions from the individual can also be limited, and thus the possibility for frustration and an impact on confidence that can snowball negatively over time. Feeling as though the effect that I want to have on the world, it doesn't happen, and no one's actually helping me to achieve it. And in fact, they're applying their own moral lens to which they observe my behaviors, which is wholly different from what I wanted to achieve. Let that emotional impact sink in for a minute. Also, non-volitional or unintentional and compulsion type motor plans can become more ingrained. The more someone does something, the more it becomes automatic. And those brain pathways get more and more myelinated over time, which is helpful for when it's something like turning on a light switch that's, becoming something you have to do every day. Or if you're Simone Biles and you're learning how to do a backflip, you want that to be automatic. But it's not so helpful when support people might be encouraging something that they perceive as purposeful or they perceive as something that you wanted when it isn't actually something that you wanted to do. The other thing that happens around this time is that people may go to compliance-based therapies as a resort, and that can really lead to learned helplessness. Remember when we talked about motivation and how important agency is? Well, when people feel like they have no control over their situation, they may begin to behave in a helpless manner because they may feel like there's no opportunity for relief or change. I keep trying to do this thing. I keep getting misinterpreted. I might as well give up. I can't do it. And interventions like this generally start around 2 years of age, 40 hours a week. Right about the same time, individuals should be exercising their sense of agency and autonomy. Agency starts really early, and I would argue that it starts actually before the age of 2. Not to mention, our health and well-being during the first 3 years of life affect all future learning behavior. So wouldn't we want kids to be able to exercise their sense of agency, especially at this age, rather than squash it and limit their choices or having their wants and joys be contingent on earning it by doing something that we've demanded? what if we had treated adults this way? Imagine if you were treated this way. These are the consequences of misunderstanding. Actions are viewed as negative and affect self-worth and confidence, and motor plans become more ingrained that are unintentional. And compliance-based therapies can lead to learned helplessness. So how can we avoid this? How can we equip ourselves to avoid unintentional harm and support agency? Let me tell you about Donnellan's least dangerous assumption, if you don't know about it already. The least dangerous assumption means, and she was talking about education when she wrote this, in the absence of conclusive data, educational decisions should be based on assumptions, which, if incorrect, will have the least dangerous effect on the student. Meaning in our case, if we presume competence that the child can learn and that motor actions aren't always purposeful, we can provide supports and access. But if we assume that they can't use these tools, or we put our own beliefs on them and say that they are intentional, that would incite harm because they never had the opportunity in the first place to do what they were intending. So the first step of avoiding unintentional harm is to be aware of these motor differences. Using a relationship also to build confidence and provide opportunities rather than break them down. Provide the correct supports. This means communication is a priority, absolutely a priority. And Elizabeth Bossler, who's speaking on spelling to communicate later, she will go all into communication. With this knowledge, support people, parents, and the individual can feel empowered, and they can have better tools to advocate so that agency can be accessed and developed. I'm telling you all these things because you might have to advocate and go to an IEP meeting for your child or someone else's child, and you might have to explain. Or you might have to explain why your kid needs a break at a family dinner when other people aren't quite understanding what these actions mean.